In normal day-to-day life, all of us experience mood swings. Small things, big things, which cause mood fluctuations, which cause us to feel low or feel high. But what happens when the intensity of these mood fluctuations goes beyond the normal? We start experiencing, if it is persistent, something known as a depressive episode, or extremely high, something known as a manic episode. Hi, I am Dr. Kedar Tilwe. I am a consultant psychiatrist with the Department of Mental Health and Behavioral Sciences, Mumbai. And today, we will be discussing the difference between depression and bipolar disorder. Let's start off with the easy one. You only feel low, you feel sad, you feel helpless, hopeless, worthless throughout the day for at least 2 weeks without the need to eat, without the need to sleep. Sleep is not possible. Difficult because of the excessive thoughts which keep coming. You have decreased concentration. You have sometimes got irritability on minimal provocation. Sometimes you will have ideas of guilt, excessive and inappropriate, and sometimes suicidal ideation. All of this combined into what is known as the major depressive disorder, where the only mood that you're going to feel is low. So this is depression, response to antidepressants, and if severe enough, response to ECTs. But what happens if your mood fluctuates or oscillates between depression and mania or hypomania? Well, what is mania and hypomania? Mania and hypomania, quite simply, are moods which are so high, so elevated, you feel so ecstatic, so happy that it feels like you're walking on air. Others are very slow, they can't understand how fast you are thinking. You believe you're capable of great things. You believe you have been chosen for a purpose. You spend excessively, you become extremely impulsive, you take rash decisions. Sleep is not possible because you don't have the time to sleep. You start at 2:30 in the night and start working. These are some symptoms of hypomanic or manic episodes. When these occur, the person is almost on a fast forward and will take decisions which are extremely problematic for their day-to-day functioning. Usually, these elevated moods are followed by a low mood or sad mood of depression and major depressive disorder. So the problem with bipolar disorder is hypomania, mania, and depression. An oscillation between the moods, a swing between the moods. Bipolar disorder responds best to mood stabilizers and treatment for depression or mania, as is the case. ECTs will help with both. Insight-oriented psychotherapy will help with both. So that is the difference between depression and bipolar disorder, or as we know it in Hindi, kabhi khushi kabhi gam ki bimari.